When most people think of World War II, they picture tanks, dogfights and soldiers storming beaches. But there was another battlefield, one just as critical, the operating room. The pressures of war forced medical innovation at a pace the world had never seen. And honestly, many of the techniques and discoveries forged in those years still save lives today. If you're passionate about history and survival, this guide will take you deep into that world. Subscribe to Wartime Survival and leave a comment about your favourite medical breakthrough. There's a lot here to unpack, and I want to hear your thoughts. World War II was a brutal laboratory of necessity. Doctors and medics confronted injuries and diseases that the world had rarely seen on such a scale. Every major battle, from the beaches of Normandy to the islands of the Pacific, presented new medical challenges. Soldiers were surviving wounds that would have been fatal just a decade earlier, thanks to innovations born from sheer necessity. The breakthroughs we'll explore weren't just theoretical. They were applied in the field, in bombed-out hospitals, in trenches, and on aircraft carriers. Many of these breakthroughs became the foundation of modern medicine, shaping practices we still use in hospitals and emergency medicine today. Blood transfusions and the creation of portable blood banks changed the way casualties were treated. Prior to World War II, blood transfusions were cumbersome, often limited to direct donor-to-patient procedures. The war changed that. The British and American armies pioneered large-scale blood storage and transport, creating mobile blood banks that could move near the front lines. Techniques for preserving blood using citrate solutions allowed medics to stockpile blood plasma, ensuring wounded soldiers could receive life-saving transfusions quickly. This innovation laid the groundwork for modern emergency medicine and trauma care. Today, the concept of blood donation, drives and trauma centres directly traces back to these wartime efforts. For survival enthusiasts, understanding blood preservation techniques can be crucial in extreme situations. Knowledge of basic transfusion methods, even in a theoretical context, offers insight into managing hemorrhage in scenarios far beyond the battlefield. Antibiotics transformed infection control and saved millions of lives. Penicillin had been discovered in 1928, but it was during World War II that it became a mass-produced, life-saving weapon. The Allies invested heavily in scaling up production, turning penicillin into the first widely used antibiotic. Wounds that would previously have led to fatal infections could now be treated effectively, dramatically increasing survival rates. The war forced rapid research into dosing, administration and storage, establishing protocols that continue to influence medicine. Modern medicine still relies on antibiotics as first-line treatments for infections. Understanding their strategic use can inform emergency preparedness and first aid practices in survival situations. Learning about how penicillin was rationed and deployed can teach critical lessons about triage and resource management under pressure. Advancements in surgical techniques improved survival in ways that are, honestly, still relevant today. Surgeons in World War II developed new approaches to treat complex battlefield injuries. Techniques like debridement, which is the careful removal of dead tissue to prevent infection, really made a significant difference. And the use of delayed primary closure, where wounds were left open temporarily to reduce infection risk, became standard practice, during this period. Field medics learned to prioritize interventions that stabilize patients for transport to more equipped hospitals, a principle that, underpins modern emergency medicine. The experience gained in managing shrapnel wounds, burns and traumatic amputations directly informed later civilian surgical procedures. For a survivalist, understanding these strategies can inform how to manage severe injuries when immediate professional care isn't available. Even basic knowledge of wound care and staged interventions can make the difference between life and death. Innovations in anesthetics and pain management reshaped the patient experience. World War II also forced a revolution in anesthesia. Shortages of certain drugs pushed medical teams to experiment with combinations and delivery methods, leading to safer, more effective ways to manage pain during surgery. Local and regional anesthesia techniques were refined to allow more precise control, reducing complications. These developments, really paved the way for modern anesthesia practices that make complex surgeries possible with fewer risks. For those interested in survival medicine, understanding the evolution of pain management provides insights into how to prioritize patient stability and comfort, even when resources are, quite limited. Preventive medicine and vaccines reduce casualties from disease. Combat isn't just about bullets and bombs. Disease has always been a silent killer on the battlefield. During the Second World War, medical teams implemented large-scale vaccination campaigns against typhoid, tetanus, and other deadly infections. They also emphasized hygiene, sanitation, and quarantine measures in field hospitals. These strategies drastically reduced mortality rates from preventable diseases, illustrating the profound impact of proactive medical planning. For history buffs and survivalists alike, this underscores the importance of preventive measures in any high-risk environment. Simple knowledge about sterilization, vaccination history and sanitation can provide a life-saving edge in both historical study and practical survival scenarios. After the war, medical research, it really accelerated civilian healthcare. Many of those wartime breakthroughs, didn't just stay on the battlefield. After 1945, the knowledge gained during the conflict, it transitioned into civilian hospitals and clinics. Blood banks became standard practice, and antibiotics, they became widely available. And trauma and surgical techniques, over time, evolved into what we now recognize as modern emergency medicine. The lessons learned under extreme pressure created a blueprint for responding to mass casualty events, from natural disasters to epidemics. Studying these advancements offers both historical insight and practical guidance for anyone interested in crisis medicine, emergency preparedness, and survival strategy. World War II medical breakthroughs were born of necessity, forged in fire and refined under pressure. They changed the face of modern medicine, saving millions of lives and providing a blueprint for trauma care that, persists to this day. By examining these innovations, we gain not only historical perspective, but practical knowledge that can inform survival strategies, emergency preparedness, and even, day-to-day healthcare understanding. If you found this deep dive valuable, make sure to subscribe to Wartime Survival for more in-depth explorations of history's hidden layers. Comment below with which World War II medical breakthrough you find the most fascinating, and share this video to keep these lessons alive. Understanding how medicine evolved in extreme circumstances isn't just history. It's a toolkit for survival.